Hello, everyone. Happy Monday. I'm Rundy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department, here to give you our Monday, August 15th update of the COVID-19 pandemics, the 16th. Gosh, I had a feeling as soon as that came out of my mouth it was wrong. Thank you, Mark. So I don't know what day it is today because our daily report did not get published today. There was something happened with the processing of the data with the state servers, and we will not have the numbers for yesterday until a little bit later. What we did produce this week is our weekly expanded report, because that goes through Saturday, ends our reporting week. So our weekly expanded report goes through Saturday, August 14th. Again, approaching 57,000 cases of COVID-19 disease, with a cumulative number of 938 who have died. Talk a little bit more about deaths in a second. So last week, 4,252 cases were reported among Mobile County residents. That was another record high number of cases for the week. So that really put us like 3 weeks in a row having breaking records for the number of cases reported. The number of cases reported in August, and again, we're just about halfway through, but the report for August has already eclipsed what was reported for the entire month of July. So far, we've had 8,136 cases reported to us, which is about 1,600 more cases in the month of August already, just half the month, than we saw in the entire month of July. And the August cases also has broken the record for the number of cases reported in any single month. And again, we're just 14 days into August. Still seeing highest rates and highest proportions and highest numbers in those younger categories, 25 to 49 leading the pack, followed closely by 18 to 24-year-olds and 50 to 64-year-olds. The number of people hospitalized with COVID, again, is quite high. Many, hundreds of people who are in the hospital on any given day with COVID. I don't have that exact number of the patients hospitalized with COVID yesterday, but I'll do a better job tomorrow of getting that information. The percent of ED visits for COVID-like illness on our report, it appears to be dipping. I think what's happened is we had one hospital go offline with electronic results reporting for a little bit, but again, we know upwards of 12, 15, 20% sometimes of the emergency department visits are for COVID-19 or COVID-like illness. I mentioned about the deaths. I had been hoping that when we did begin seeing deaths from this recent spike, that they would remain quite low, but we have had a rather dramatic increase in the number of deaths reported. Last week, 27 deaths occurred, and one of those was in someone who was 22 years old, who had underlying medical conditions, but that's still, an unvaccinated person. That just seems too young to lose a life to COVID-19 when there is a safe and effective vaccine that can prevent hospitalizations and deaths. So last week, 27 people who died with COVID-19. The week before that, it was 19. The week before that, it was 12. The percent positive is still very high, above 25, 30%. So that is still looking not good. And, when we look at the 2-week rate, the map cannot get any more red. It's just super high levels of transmission all over the county. Let me see if there's anything else I wanted to mention about how bad the COVID numbers are. Let's see, just wanted to, last week The hospitals are starting to publish data on what's happening in their hospitals. I think this is really good news, that other people are helping us get the message out about how bad COVID is right now in our community and the extraordinary strain that it is putting on our healthcare system, not just our hospitals, but all of the testing facilities are overwhelmed. All of the ambulance services are overwhelmed. So again, please don't seek testing at the emergency department. If you need COVID testing, please, see a provider or a clinic. Go to the emergency department if you need emergency medical care. But just remember that we're trying to encourage the use of a vaccine, encourage masking and distancing so that we can slow this rapidly growing wildfire called COVID-19 that we have in our community. I wanted just to say, if you are watching Facebook Live today, or if you review our posts on social media, then you probably have seen that we are no longer providing testing or vaccines at the mall space that we rented, the old Forever 21. And I'm going to read a statement about that. We rented space at the shops of Bel Air for COVID vaccination and testing. And in just 10 days that we were there, August 4th through the 15th, we vaccinated 1,127 people, and we tested 4,461 people for COVID-19. We are thankful to the mall for making that space available to us at quite a low cost. And we are disappointed that we had to relocate that space. So we were told by mall management that they received notice from another tenant that our services were negatively impacting their businesses. And on Friday, we were officially told that we had 3 days to vacate this space. So we packed it up last night, and for now, we are back at the New Bern Health Center on 248 Cox Street to provide vaccine and testing there while we look to see where we might be able to go next. So we need a big open space with electricity and a good air conditioner and bathrooms, and maybe, a few smaller rooms. So if you have space that fits that need, probably 10,000 feet or so, 10,000 square feet or so, please, send us a message over social media and let us know if you have, space that has a good floor, big wide open spaces, with power and air conditioning and nice bathrooms, or at least clean bathrooms.
Testing's at New Bern, not the Women's Center.
Right. Mark is reminding me to mention that at the New Bern Health Center on Cox Street, the testing and vaccination is at the entrance, the side of the complex that is on St. Stephen's Road. Please do not go into the Women's Center to get treatment, to get testing or vaccination for COVID. We just, opened that location back up today. We had an extraordinary number of people who were in line before we opened, and so it's going to take us some time to to work out the kinks. All right. Bunch of questions. Let's see. Somebody asking about why we left the mall. Also, if we are doing any testing in schools, yes, we have been doing. That's asking about testing in schools. We are the Mobile County Health Department is not currently doing any testing in schools. Most schools have declined to participate in what we call surveillance testing, or, testing asymptomatic students on a voluntary basis. What we have agreed and will assist them with is if they want to do testing to try to stop an outbreak. That's a really good way to try to identify everyone who's positive and get them to go home. That's a great way to slow your outbreak down. So we have offered to assist in that way. The the partnership between ADPH and UAB on school testing is a statewide activity. We have been involved in those conversations and those discussions, and are looking forward to seeing how that's going to roll out. Let's see, someone else asking about why we left the mall, and somebody else asking about why we left the mall. Yeah, we're really sad about it too. Okay, someone reminding me that CDC has authorized a third dose for people who are moderately to severely immunocompromised, and we have already begun giving third doses at the Mobile County Health Department. There are a couple of things. You don't need a doctor's excuse or anything. We're not going to verify that you need a third dose. What we are going to do is make sure we know what product you received. So if you need to bring your card so that to show us what vaccine you got, so that we can give you a third dose of Pfizer or a third dose of Moderna. If you don't have your card, we will look it up, which will cause a little bit of a delay, but we can get it done. And we'll give you a third dose of the same product, and it needs to be no sooner than 28 days after you completed the series. So remember, the series is you get your first shot, you wait either 3 weeks or 4 weeks, depending on what product you got. You get your second shot, so it'll then wait at least 28 days before you come seeking a booster dose or a third dose. So that answers a couple of those. Someone expressing some frustration. Is there anything that can be done when you know people are testing positive and they're not quarantining? So unfortunately we have to rely on the honor system for people to isolate and quarantine as they are directed by public health or by their work or school. Someone also asking about breakthrough cases, so cases in people who are fully vaccinated. So there are some sort of aggregate data on that. We know that it's happening, but it's extremely, something like 0.02% of the people who've gotten vaccinated have actually been diagnosed with COVID. So it's extraordinarily low number of people. But when it happens to you or your neighbor, it seems like it's happening all the time, right? So we do expect there will be COVID infections in people who are fully vaccinated. And then there also will be reinfections in people who had COVID previously and are not don't have enough natural immunity to protect them from getting it a second time. How soon can you get vaccinated after you recover from COVID? So when you get COVID, you have to be at home for 10 days. If on the 10th day you have been well for the last 24 hours, you can seek a COVID vaccine. Someone complaining that, I have said made sure that people understand that isolation is for 10 days and quarantine is for 10 to 14 days. We prefer 14. And that for households that can't, separate, they can't prevent exposure. If you get someone in your house with COVID and you're not able to keep them away from your children or the rest of your household, that means your household has to stay at home while they ride out their 10 days. And then once that 10th day occurs, then the rest of the house can start their first day of quarantine, and that goes for 14 days. Yes, I recognize that is quite a long time to be out of work and school. So our best advice is to get vaccinated. Get everyone in your household vaccinated so that if they are then exposed, they do not have to stay home. Someone asking where 14 days come from. Wow, I haven't gotten some of these in a really long time. So for COVID, for newly infected people, right? If you're exposed today, people will get sick between 2 and 14 days, right? So that's where the 14 day, it has to do with the science around the COVID transmission or the way the infection occurs in the body. So that's where 10 days came from, because you can, I think it is that you'll develop symptoms or you'll be infectious to other people around 5 days, but it can happen as soon as 2 and can happen as late as 14. So that's where the 14 days comes from. What should we do if everyone is vaccinated and one still comes down with COVID? Well, the one that comes down with COVID has to stay at home for 10 days, and the others who are vaccinated can continue to go to work and school, but they should wear a mask for 14 days and should consider getting tested a few days after they're exposed. Someone asking what happens if a teacher has COVID? Who has to isolate and for how long if you've been exposed? It doesn't matter who, if it's a teacher or a doctor or a clerk or a custodian, and everybody who gets COVID has to go home for 10 days. And then everyone who was around them within 6 feet for 15 minutes or longer is considered a close contact and should go home for 14 days. The only time this is different is for in the K through 12 setting, children may be allowed to stay at school if the kid who had COVID was wearing a mask and the child was wearing a mask. But if no one is wearing masks, everyone should be excluded from school if they are around someone with COVID. What do we do when an employee comes back from COVID and is preparing food with no mask and gloves? Well, if they stayed home for 10 days, then they would not be infectious when they come back. But wearing a mask is still a strong recommendation for people working in settings where they have to interact with the public. Do I know if schools are accepting at-home test results, or do they have to come from a doctor's office? I don't know. I presume that they would accept an at-home test. So someone here asking about treatment for COVID. So there are really only 3 treatments for COVID: remdesivir, 2 different kind of monoclonal antibodies, and convalescent plasma. So most of those have to be administered in a healthcare setting. There's not now there are outpatient opportunities to get those treatment. And the health department, our chief medical officer, Dr. Laura Cepeda, is having conversations with providers around the county, particularly hospitals, but other provider types, to see if we can get docs to begin providing the monoclonal antibody treatment in an outpatient setting and doing it subcutaneously, which can be done in just in a doctor's office setting. It doesn't require a hospital setting, so that we can try to get that treatment to more people. All right, any questions?
This is from the recorder.
Okay.
Can you put those numbers in context? Is that double or triple what you were doing at the previous location?
Talking about for testing and vaccination?
At the mall.
So what we were doing at the mall far exceeded anything we had been doing at our clinics. On average, in the clinic, we might give 30, 40, 60 maybe vaccines a day. We may be able to test 100, but on our busiest day last week, I think it was Friday, they tested 650 people in one day. So we had really good response at the mall. On average, vaccinating 110 people each day, and on average, testing around 450 people a day, which was really great. I mean, we are all super tired because of it. It was really, really busy, but we got a lot of very positive feedback from the community thanking us for what we were doing. And thanks to the staff who worked out there for making that happen for the short time that we were able to be there. So again, then we vaccinated at the mall over that 10 days more than twice as many people as we had vaccinated in the previous week, where we went to 23 different locations to give vaccine. So it was quite a productive location. All right, so I will promise to have the right day tomorrow when I show up for Facebook Live, even if I don't have the day's report. Please be safe. Remember, the only way we're going to stop this outbreak is by getting vaccinated, wearing a mask, and distancing. Let me just say one more thing about, I was pressed last week to ask my opinion on whether or not we need a mask mandate. And I have gone on record as saying we don't need a mask mandate. We need people to get vaccinated. Masks are extremely important right now. Everyone should be wearing a mask. Every business, every agency, every school, every daycare should be having your employees and your customers wear masks. That's the only way we're going to slow this outbreak, through layering those prevention measures of vaccine, masks, and distance. But we ought to know on our own that it's the right thing to do and not have to have somebody tell us that it works. It slows outbreaks. It stops transmission. So please do your part and help us prevent, unnecessary hospitalizations and deaths. Get vaccinated. All right, we'll talk again tomorrow.